Patient advocacy really just means a patient speaking up for what they need and being informed about health, their own personal health, and then about the disease process that they're seeking care for. And a lot of that education happens in the office, but when you come to a new patient visit, being an advocate means knowing what you want from a particular provider that you're seeing, knowing what's happened previously in terms of other diagnostic workup you've had done, other medications you've taken, other medical problems you have treatment for, and what other physicians are involved in your care, and relaying that to the provider. It means coming with a list of questions that you want answered, and an explanation for what your expectations are. When you're coming, everyone has a goal for what they want from the provider, whether it's a diagnosis or a treatment plan or more education about what they can do outside of office visits or outside of medication. And coming to a visit prepared and ready to speak on that really enables the provider to give you the best options that are perfect for your condition. When you come in prepared to talk about what you need from a provider interaction, it increases the likelihood that you get a specific diagnosis. So if I know more about what you're experiencing and what's been done, I have more information to make an accurate distinction. So it may be the difference between me labeling you as headache, which is really just a symptom, and saying, oh, no, you have chronic migraine, which has its own set of treatment options that's really specific to that diagnosis. So having a specific diagnosis improves your opportunity for getting better and having effective medications. The other is that I think advocating for yourself helps you get the care you need faster outside of the clinic room. So one part of advocacy is knowing the limits of your health insurance plan. So you knowing what the benefits are and what your, for example, drug formulary is can make the difference between when you go to the pharmacy and them say, I'm sorry, you can't have that now, we're waiting on X, Y, and Z to happen, versus you getting a medication and leaving and be able to start treatment effectively. And patients who know that and can ask the right questions, have more success in treatment. In my clinic in particular, we try to give you information before your visit with an intake packet, which is a questionnaire essentially that gives you all of the lists of information that we need from you to make it the most successful visit. And many specialty providers have something like that, and that's accessible to patients prior to the visit. For example, ours is available online. Many other providers may mail it to you ahead of time. But taking time to sit down and reflect on that the day before or a week before the actual visit, rather than the morning of or in the waiting room, I think gives you more of an understanding of what the provider is looking for, and so you can come prepared, because it may mean getting records from another physician who's in a different health system, other imaging results, a list of medications you had from the pharmacy that you tried previously that you no longer take. So there's a little bit of homework involved, but doing that ahead of time really makes the best use of the time that you have one-on-one with the provider. And I think just sets the tone that you're thinking about what you want to say and what you want to ask before you're in the room and on the spot. Because many of us you have a whole bunch of things going on in your life, and then you remember with a calendar pop up on your phone, I have a doctor's appointment tomorrow. Oh yeah, I made that 3 months ago. What was it for? Oh yes. And that's where you start the visit, is that I just remembered I'm supposed to be here, and you haven't really thought critically about what you wanted to say. And it may come to you after the moment has passed, after you've left the room and the week following, and then you think, oh, I missed my chance. I think when patients are really afflicted by a disease process, oftentimes there are other people involved in their care, spouses, loved ones, family members, maybe professional caregivers, and those are great people to have as a part of the conversation. If they're not physically in the room with you, in modern technology, they can be on a smartphone and be FaceTiming or Zooming into the provider encounter and be a part of the conversation. And I think that's helpful even when patients may not view themselves as being too sick to have other people involved in their care, but to get another set of ears who are also hearing what the provider says. So I think you see the influence of patient advocacy in creating conversation about disease process and really making known what is important to patients. So if you think migraine really is disabling and affects your life and you can't go to work or you can't complete your schoolwork or it's affecting your ability to parent, but no one knows about it, no one invests the time and energy to make that experience better. I think having a voice really creates recognition.